Great presentation, Dr. Pisconi, great presentation. And I was intrigued by what Chuck just said when he said, what matters to the patient. What's interesting, maybe they don't know what matters until later. I thought of my basketball player who just wanted to get back, and what mattered to him was getting into the game and getting minutes. But really, like Dr. Bisconi mentioned, and my concern was, how's his knee going to be 5-10 years later? And I think that's some of the issues with people who dislocate their shoulders, is what's happening long term. So is non-operative treatment effective? What is the functional scores, if you will? Well, we know the shoulder dislocates quite frequently, unfortunately. If you look at the NFL Combine type of information, it's about 10% of all players. It's the fourth most common procedure seen in football players. But also realize there's other sports that people dislocate. Here's a very famous shortstop sliding in the third base, catcher covering third, dislocates his shoulder on opening day, was treated non-operatively, and we had a very, very successful outcome. To this date, he still hasn't gotten his shoulder fixed, but it's his non-throwing shoulder, and he was committed as far as being slow with his rehabilitation from a time frame. Here's another outfielder who dislocates his shoulder. It's sliding in the second base. Somebody falls. Head first sliding is not a great idea for young people. And this particular individual had recurrent symptoms as well. And this guy, if you saw this in the World Series, it's a home run and high fives in a very aggressive manner, and his shoulder slips out, and after the World Series had shoulder stabilization. So things happen. Here's a basketball player. I'm not sure this is going to play. Let's see if we can get it to go. Maybe not. This is a very good female basketball player who dislocates her shoulder in a national championship game. Actually, it was the semifinals. Yep, not going. That's okay. And she stays in the game, winds up playing multiple years there later with a shoulder brace on, and unfortunately pays a little bit of the price with a beat up shoulder later. Brett Owens, Dr. Owens has pointed out in college athletes, there's a lot of shoulder dislocations, about 4,000 over a 16-year period, males more than females. Females are more likely to sustain an injury to an object, whereas males are more likely to have an injury secondary to a player. Chuck made a great point. I think it depends on who it is. And I think Brian made that point as well. An elite athlete like this individual, you'll see him in a second, dislocates his shoulder. Well, that's a different treatment approach versus that high school athlete where we're thinking about their shoulder long term. And sometimes a 16, 17-year-old doesn't really understand what's best for them. Or the recreational athlete who doesn't have to get back right away, but it's really contingent on their aggressiveness, what their activity level is. Just like that elite athlete, what sport do you play? What position? If you're a cornerback, wide receiver, you need to have your shoulder fixed right away. You're not going to do very well. It cost the Patriots a Super Bowl. Sorry, Brian. One of your cornerbacks in the end zone had shoulder dislocations and was playing with that with a brace and couldn't get his arm up overhead. So again, other factors that you didn't quite hear yet is arm dominance. I think you do a little bit better non-dominant arm in a sport like basketball and so forth. Age matters. Seems like the younger people are more likely to dislocate again. And it depends again on what you're going back to. People do crazy things, or at least what I would consider crazy things on their shoulder. Here's an exercise, in CrossFit where she's just going ballistic on her pull-ups. Here's a gentleman doing a lift overhead and dislocates his shoulder out the front. And unfortunately, he's got his friend videotaping the event as well. Other aspects to consider is obviously direction. Anterior is the most common, but we see a ton of posterior dislocators. And a lot of those individuals can be rehabbed, treated non-operatively, especially if they're interior alignment. The ones I really worry about the most are wrestlers, gymnasts, because of overhead activities, competitive cheerleaders as well. So if you're a recreational athlete and your goal is to get back to mountain climbing or cliff climbing, you need to have your shoulder fixed. If you just play basketball recreationally and it's your non-dominant shoulder, well, let's rehab you for a little bit. This is some slides from my friend Matt Preventure that shows, and we've seen this quite a bit with football players, if you've torn your labrum and you have a bank card, even though it's a small bank card, but you continue to play and you keep slipping out, what'll happen is the tear will extend, and many times it will extend from anterior to posterior. So now you end up with an anterior and posterior bank card. Also, you may develop a Hill-Sachs lesion, but also, as Dr. Biscondi mentioned, you may have some bone loss on the glenoid. More capsular injuries, like we talked about, and more of an off-track type of Hill-Sachs. So we have to know what we're dealing with. And this goes to therapists when we talk about treating somebody non-operatively. Is there glenoid bone loss? Is there humeral bone loss? Is the orientation of the retroversion of the glenoid makes this person more susceptible? What's their neuromuscular control of the scapula as well? So let me make a couple of last key points here. This is the player that I mentioned before. For some reason, my videos are, I'm just having a glitch for some reason. This guy's going to make a tackle. So he's the guy you saw. He was on the Washington football team at the time, and he's a running back, and there was an interception, and he makes a tackle, and he dislocates his shoulder. Well, as Chuck mentioned with Ellen's very nice study, they had 85% return back non-operatively to sports within at least a year, which is fantastic. Dr. Buss up in Minnesota had 26 of 30 return at an average of 10 days. So I think you can get these people back with a brace fairly soon. But what's the long-term effects? Dr. Arciero and Dr. Taylor, when they were at West Point, pointed out 90% will develop recurrent instability. Halveris out of Sweden with a 25-year follow-up said about 50% will have multiple recurrences and about 7% one occurrence. And as I mentioned before, it really depends on who we're treating. Ultimately, we're talking about the return to sports. 40% returned without a recurrent in the Dickens study. 90% of the post-ops returned without a recurrence. One had shoulder instability. So the recurrence rate, we believe, is much greater, as you see in the literature, the younger, more aggressive individual going back to collision contact sports. Thank you very much for your attention.